Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Ever felt like you're just wading through medical information? Especially with new treatments, it can feel pretty overwhelming.
It really can. So much jargon out there.
Exactly. Well, today, we're going to try and cut through some of that noise. We're doing a deep dive into a specific class of medications called JAK Kinase Inhibitors.
That's J-A-K.
Right, J-A-K. But it's pronounced JAK. So we'll be calling them JAK inhibitors for this discussion.
And these JAK inhibitors, they're a really fascinating area in treating inflammatory conditions. A significant development, actually.
Yeah, they sound it. Now, our information for this deep dive comes mainly from Alberta Rheumatology's YouTube channel and their website. They do a great job laying things out clearly.
They really do. Very helpful resources.
So our mission today is basically to take that info and make it, understandable and useful for you.
Yeah.
We want to cover what these JAK inhibitors are, how they actually work.
Their benefits, any potential issues or things to consider.
Right, and really what you need to know if these drugs come up, maybe in a doctor's appointment or just in conversation.
Think of it as getting you up to speed on a key advancement in rheumatology without needing a medical degree.
Okay, so let's unpack this then. We've got the name JAK inhibitors. But what are they, fundamentally? How do they fit into the picture of treating these chronic inflammatory conditions?
Okay, so at their core, JAK inhibitors belong to a group of medicines we call DMARDs.
DMARDs, disease-modifying anti-rheumatic drugs.
Exactly, and that disease-modifying part is really important. They're not just about symptom relief. They aim to actually change the course of the disease.
How do they do that?
Well, JAK inhibitors work by blocking the activity of some very specific enzymes in your body called JAK Kinase enzymes, JAK again.
Janus kinase enzymes. Sounds pretty technical. What do they do normally, and why is blocking them helpful for inflammation?
It's a great question. It gets to the heart of their targeted approach. So imagine your immune system is like this complex communication network. In conditions like rheumatoid arthritis, that network goes a bit haywire. It's overactive, sending out constant signals that trigger inflammation.
Right, the body attacking itself.
In a way, yes. And these Janus kinase enzymes, they're like crucial relay stations in that signaling pathway. They pass the message along.
Oh, okay.
So when a JAK inhibitor blocks their activity, it basically interrupts those specific inflammatory signals right at a key point in the chain.
So it's not like hitting the whole immune system with a hammer then.
Yeah.
It's more targeted, like calming down just the parts that are overreacting.
That's a really good way to put it. It's about precision. Disrupting those specific signals leads directly to less inflammation.
And that's the calming the immune system down effect we hear about.
Exactly. And, it's worth noting these are relatively new players on the scene. They're a newer class of DMARDs. The first ones were approved in Canada around 2014, so they represent a more modern approach.
Okay, that targeted idea sounds promising. So who are these JAK inhibitors typically for? Who benefits most? And maybe the big question for patients, how quickly do they start to work? Because waiting months for relief is tough.
Absolutely. Their main use is for conditions like rheumatoid arthritis, but also other kinds of inflammatory arthritis. Basically, diseases where the immune system is mistakenly causing inflammation in the joints and sometimes other tissues.
And are there specific ones people might hear about?
Yes, the sources mention three main ones currently used. There's tofacitinib, the brand name is often Xeljanz, then baricitinib, which is Olumiant, and upadacitinib, known as Rinvoq.
Xeljanz, Olumiant, Rinvoq. Got it. And a big plus for all of those is that they're pills, right? Taken by mouth.
That's right, all oral medications, which, as you say, is a huge convenience factor for many people compared to injections or infusions.
Definitely. So back to the speed question. How fast can someone expect results?
Okay, now this is where it gets really interesting. Compared to some older DMARDs that might take several months to show their full effect, patients on JAK inhibitors can often start feeling better surprisingly quickly.
How quickly are we talking?
We're talking benefits potentially seen as early as 2 to 4 weeks after starting the medication.
Wow, 2 to 4 weeks. That's a game changer for someone in a lot of pain.
It really can be. That rapid onset is a major advantage. And it's also worth mentioning, they seem to be about as effective as the other newer drugs for rheumatoid arthritis, the biologics, which are usually injections. So you're getting similar effectiveness, but in a pill form.
Okay, that's really compelling. So let's talk specifics. For someone, dealing with that constant pain, stiffness,
Mm-hmm.
what does that feeling better actually look like day to day when these start working?
Right, let's make it concrete. Imagine someone maybe struggling with really swollen, painful hands from RA.
Okay.
The sources point to several key benefits. First, you'd expect to see a noticeable decrease in that swelling in the joints. Less puffiness, less tenderness.
That alone would be huge.
Absolutely. And hand in hand with that comes improvement in pain and stiffness. So maybe waking up in the morning feels less like an ordeal, moving more freely, less aching.
Being able to, grip things again, open a jar.
Exactly. Those everyday things. It translates directly into improved day-to-day functioning. Getting dressed, cooking, working, hobbies, all become easier as the pain and stiffness subside.
So it's about getting back to a more normal life.
Precisely. And there's a crucial long-term benefit, too. JAK inhibitors help reduce irreversible joint damage. That's vital for preserving function and preventing disability down the road. It's not just about feeling better now, but protecting your joints for the future.
That paints a really positive picture, quick relief, better daily life, and long-term protection. But, with powerful medications, there's always the other side of the coin. Considerations, potential side effects.
Yes, absolutely. It's essential to have that balanced conversation.
So for someone thinking about starting a JAK inhibitor, or maybe already taking one, what are the practical things they need to know? What are the potential downsides or things to watch out for?
That's a really important part of the discussion. While they are generally well tolerated, like any effective medication, JAK inhibitors do have potential side effects that patients and their doctors need to manage.
Such as?
Well, some common things might be an upset stomach, which is often manageable, but there are more serious considerations too, because they work by modulating the immune system.
That targeted calming effect we talked about.
Exactly. That means there can be an increased risk for serious infections. Your body's defenses might be slightly lowered against certain bugs.
Okay, that makes sense. It's that trade-off again.
Yeah.
Calming the inflammation versus maintaining full defense. What else?
Other potential issues include the possibility of lower blood counts, red cells, white cells. Also, they can sometimes cause an increase in cholesterol levels, and occasionally liver irritation can occur.
So things that need monitoring.
Definitely. Regular monitoring is key. And another risk that's been highlighted is a slightly increased risk for blood clots, like DVTs or PEs in some patients.
Right. So given these potential issues, how can people manage these risks? What's the practical advice?
That's the crucial question. How do you use these drugs safely and effectively? The sources offer some very clear, actionable guidance.
Okay, like what?
First off, combination therapy. Most rheumatologists actually suggest continuing methotrexate if you're already on it when you start a JAK inhibitor.
Oh, so not necessarily replacing methotrexate.
Not necessarily. Studies show the JAK inhibitor often works significantly better when it's combined with methotrexate. It seems to be a synergistic effect. So it's often about adding to it, not swapping, to get the best result.
Got it. That's important. What about dealing with potential problems like infections?
There's specific advice on that. It's called the fever protocol. Basically, if you develop a fever while taking a JAK inhibitor, you should skip your next dose.
Skip it entirely.
Yes, skip that dose and call your doctor or healthcare provider. A fever could signal an infection, and you want your immune system fully operational to fight it. Once you're feeling better, it's usually safe to resume, but always check with your doctor first.
That sounds like a very clear, practical rule to follow. What about the monitoring you mentioned?
Absolutely essential. Regular blood work is a must. Your doctor will set up a schedule to keep an eye on your blood counts, liver function, cholesterol levels, things like that. It's standard procedure to catch any potential issues early.
Okay, and communication.
Crucial. Always keep your doctor informed. Tell them about any other medical conditions you have, heart issues, history of clots, chronic infections, anything. And let them know if anything changes with your health. They need the full picture to advise you properly.
Makes sense. Life happens, things change. What if someone just forgets a dose? Does that mess things up?
Good question. Happens to everyone. The advice is clear. If you miss a dose, just skip it. Don't take an extra pill to make up for it.
Don't double up.
Right. Just take your next dose at the usual time. Missing one dose isn't likely to cause any major problems or loss of benefit.
Okay, that's reassuring. And what if someone needs to stop taking it altogether, maybe for surgery or another reason? Is it hard to stop?
Actually, no. Unlike some medications, you can usually stop JAK inhibitors abruptly. There's no need to slowly taper or wean off the dose.
Oh, interesting.
It's safe to just stop. But, and this is important, you need to be aware that any benefits you were getting, the reduced pain, the improved function, those will likely start to fade over a few weeks once you stop.
Right, the effect wears off. So stopping is safe, but you'll probably notice the difference. A decision to make with your doctor, obviously.
Always in consultation with your doctor.
This has been incredibly helpful, really practical advice that gives people, a sense of control and understanding. We've covered a lot today, really getting into the details of these JAK kinase inhibitors.
We have, from the basics of how they work by blocking those Janus kinase signals,
to the really tangible benefits like reduced pain, less swelling, better movement, and that crucial long-term joint protection. Often starting quite quickly, too.
And we've also covered the important practicalities, the need for monitoring, managing potential side effects like infections, and the importance of things like the fever protocol and talking to your doctor.
Yeah, transforming what can seem like really complex medical stuff into, hopefully, clear, usable knowledge.
Exactly. Understanding the what, the how, and the what to watch out for.
Thinking about it, as we've discussed, these JAK inhibitors work by so precisely tuning the immune response, blocking specific signals, not the whole system.
That's the key, the precision.
Right. And that delicate balance, calming the harmful inflammation while trying to keep the protective parts of immunity strong, it really highlights where modern medicine is heading, doesn't it? That search for incredible precision.
It really does.
It kind of makes you wonder, how many other conditions, maybe even common ones we don't always associate with the immune system, might eventually be managed by similar kinds of targeted internal adjustments, moving away from broader treatments towards these more fine-tuned approaches.
It's a fascinating thought. It definitely points towards a future of more personalized, precise medicine, aiming for better outcomes with fewer side effects.
That's at least something to ponder. Now, as always, we need to emphasize, this information is for your understanding and awareness. It's not medical advice.
Absolutely. For specific advice about your health situation, you must always consult your own physician or healthcare provider.
They know your history and your specific needs. And for more general information, the Alberta Rheumatology website, our main source today, is a fantastic resource. You can find that at albertarheumatology.com.
A great place for reliable information.
Well, thank you for joining us on this deep dive today. Hopefully it's shed some light on these important medications.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifun, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.